I always knew I wanted to be a social worker. I always thought I wanted to work with either the elderly or babies. My name is Fran Altmaier, and I'm the Case Management Coordinator with the Office of Newborn Screening. I have worked for the state for 28 years now, and my first 18 were at DES providing case management to infants and toddlers with developmental disabilities. One day I decided I'm ready for something different, and I started looking, and the opportunity came up with the Department of Health in the newborn screening program. And so I jumped at that opportunity to continue my career and to continue to be able to help babies and children in Arizona. When a baby's born, at about 24 hours, they have a newborn screening test called a heel stick. And they take 5 drops of blood from the baby, put it on a special filter paper card, and it comes here to the state lab where we run a series of tests. We're currently testing for 31 conditions from those 5 little drops of blood. And we provide follow-up on anything that's not normal for those tests. So it could be a borderline result, it could be an abnormal result, it could be a really critical result. So newborn screening gives us the opportunity to screen these babies before any concerns arise. And any baby is at risk for something in newborn screening. And the important thing to know about this is that everything we screen for has a treatment available. And early treatment and early identification is the key to the best outcomes. Before newborn screening, these children ended up in wheelchairs, on ventilators. They had a lot of lifelong health implications. Now with newborn screening, these children are able to achieve all the developmental milestones at or near pace with their same age peers. A lot of our day is spent calling families, documenting our interactions with the families, sending results to doctors, coordinating the care between a doctor and a specialist. Sometimes we play detective. We're trying to find a family because we have instructions that it's time critical that we reach them. Sometimes it's really difficult to call a family with news that we know is going to change their life, turn their world upside down, but we're also offering them solutions. We're connecting them with the doctors, with the resources and services that they need to take that next step, to make it not so scary. And I help coach my follow-up team to be able to have those conversations with families that may be really difficult, but they need to happen because it's really, really important what we do. It may be really, really scary to hear these words, that your baby might have something, but it's up to us to talk the family and the physician through that. Make sure that the physician knows where they can refer this child to get the diagnostic testing or the care or the treatment that will ultimately save their baby's life. Newborn screening and the ability to help families and identify things really is important to me as a social worker. I went into this career because I want to help people. I want to make sure people have what they need to be successful. And newborn screening is at the bottom of that. It makes me feel really good at the end of the day, knowing that I've been able to help a family and help their baby. It's what I became a social worker to do, is help people. Doesn't matter, I think, as a social worker, where you're at or what you're doing. If you're helping people, then you've had a really good day. Hearing back from families on what their experience with newborn screening really drives home what we do. And as a social worker, that's where I enjoy hearing family stories, that I've been able to make a difference in their family's life. Part of newborn screening as a national program is that there are new conditions always added to the newborn screening panel. And Arizona was in the process last summer of bringing on 2 new conditions, one of those being spinal muscular atrophy. And as part of that, the laboratory had equipment installed, and they had to validate that the equipment was working and the results were reliable. And as part of that, they identified 2 babies who potentially had spinal muscular atrophy. We had all the public health systems in place, and both those babies were treated very quickly. And before spinal muscular atrophy was added to the newborn screening panel, we had families that went to the legislature, spoke their stories and shared them. And I had the opportunity to meet one of these families recently. We had little Stella came to the state lab and took a tour. She's a 2-year-old little girl who has spinal muscular atrophy. She was identified with spinal muscular atrophy before we screened for it. Little Stella's doing great. I chat with her mom on social media, and she's come to the lab and visited us, and she pushes her wheelchair around like a pro. She's a pretty amazing little girl. But with newborn screening, children like her will have the opportunity to walk. Coming to work each day, you never know what the next day is going to bring, and that's what makes the work interesting. The Department of Health is a place where you can come work and be here for a really long time and enjoy it and know that there's always opportunities to learn and grow in your career. This isn't just a job for me, it's an opportunity to really make a difference. So at the end of the day, I'm really proud of the work that I get to do every single day.